So I want to talk to you about peripapillary wrinkles, retinal folds, and choroidal folds. And these are all seen in patients who have papilledema. And the reason it's important is if we see a disc that's swollen, that's just optic disc edema. But if that optic disc edema is from increased intracranial pressure, we call that papilledema. So we reserve this word, papilledema, for disc edema secondary to increased intracranial pressure. Every other form of disc edema we should just call disc edema. And so when we're looking at the disc and it's swollen, we can see folds, either in the retina, on the retina, or under the retina. And so on OCT, we see a swollen nerve like this, and this is the optic nerve that's swollen here. If we see that it's on top of the retina, these are the peripapillary wrinkles. If we see the folds that are in the retina, that is a retinal fold. And if it's under the retina, that is a choroidal fold. And the folds are at different levels. And the OCT allows you to see whether it's a fold on the retina, in the retina, or under the retina. The retinal folds either are going to be harmonious with the choroidal folds, or the choroidal folds and the retinal folds may not align, and that is inharmonious. These are all caused by the same problem, of course. Here's the eyeball, and you got optic nerve. Fluid in the sheath, that's the cerebrospinal fluid. That fluid acts like a mass and presses on the back of the eye, shortening the eye, and that can cause the hyperopic shift. It can cause folds to develop in the choroid, and those folds can be transmitted visibly to the retina, and we can get the peripapillary wrinkles. So when we see a swollen optic disc, what you're seeing is the axoplasmic flow stasis caused by the pressure pressing on the back of the eye. And because the pressure is felt differentially at this location, folds will develop. And so those folds represent different stress and force lines that are being applied by the intracranial pressure, the fluid pressure, on the back of the eye. And so when we see a swollen disc, we might see concentric folds like this. We might see retinal folds like this, or we might see bigger folds in the choroid that are deeper. These three different folds, peripapillary wrinkles, retinal folds, and choroidal folds, are very important things to write down when we see optic disc edema to help convince us that it's actually papilledema and not some other cause of disc edema. However, when you get the peripapillary folds, that can just be from a swollen disc of any sort. And so it's not 100% reliable to differentiate papilledema from other causes of disc edema like non-arteritic anterior ischemic ophthalmopathy. However, if we see flattening of the globe radiographically, fluid in the sheath, choroidal folds, that's pretty much going to be real papilledema. If we see the retinal folds, the Patton's lines, especially the peripapillary ones, and peripapillary wrinkles in combination with the other ones, these are the ophthalmoscopic findings that this disc edema might be true disc edema from papilledema. There you go.